reconciliation bill, sometimes referred to as the big one big beautiful bill, created changes in Medicaid. Some of those are going to put considerable stress on rural healthcare providers. To try and cope with that stress, the Congress also created the Rural Health Transformation Fund. All 50 states have a portion of that fund. Some not proportional to others. We're one of those states that actually has per capita one of the largest amounts. It'll top out over the next 5 years at a little over $1.1 billion that will come to the state of Kentucky to transform, reinvent, and strengthen rural health care. It does not specify research in the bill, but comparative outcome analysis is part of any good policy change. And so there will be opportunities to study the effectiveness of different approaches in the bill. So this is being administered at the state level. You'll hear more about that in a minute. They are looking to some extent, to a great extent, the two R1 University, us and our cousins down the road, to help carry out the reforms and to propose the reforms. So that's really what we're here to talk about. 5 years, $1.1 billion statewide, and how do we strengthen and make more resilient rural health care. So I'll turn it over to Ian and take it away.
Thank you, Dr. Klein. So I'm going to lead by saying that typically I'm short with my talk. So this is about a 20-25 minute presentation. In large part, it's that way Dr. Bullard-Dunn and others can, and I can answer questions at the end, right? And Dr. Klein, thanks for that lovely introduction. You just saved me one slide right in the middle of this deck. Are we advancing? Thank you, Josiah. Keyboard. Am I clicking here? Okay. Well, thank you for that, Dr. Klein. So Dr. Klein described sort of the background of where things are. I'm going to lead with the September 2025 date here, where the $50 billion was awarded in new funding to rural health. All states received $100 million as sort of an equitable division of that. But then based on the strength of your proposal, as well as geographic square mileage and your rural population, you were then awarded additional dollars. And we received $112 million in addition to the original $100 million base. So our total is $212 million for this fiscal year for 2026. And you should know that we are ranked 11th in the country, Dr. Klein, which suggests that once again, we're punching above our weight class in terms of our ability to capture dollars from the federal government. The focus of this transformation program has been to be aligned with Make Rural America Healthy Again, focusing on chronic disease, behavioral health, prenatal care, and disease prevention. And we're going to focus more of that, or we're going to talk about that more at length in later slides. Other themes that you're going to see throughout this program is sustainable access. We don't want to leave our rural patients and partners behind in year 6. And so we need to create sustainable programs, workforce development, which is sorely needed in these regions, as well as innovation of care and tech innovation. Throughout this program, you're going to see a lot of technology that's going to be deployed throughout many of these initiatives. Now, we use the term pillars often in our strategic plan at UofL. I would replace that and start to use the state nomenclature of initiatives, which is sort of their verticals of their 5 major initiatives. In November 2025, the state of Kentucky Cabinet for Health and Family Services applied for funding. And then they were awarded the funding in December of 25 of the $212 million. Now, it is renewable each year through 2030. What is an important distinction today is this is not a grant. We are not guaranteed $212 million per year. how well we deploy funds in year one, how quickly and will be graded by the federal government, since the CMS, the Center for Medicare and Medicaid Services, is the source of these funds. And so it's imperative that we develop timelines and plans that unlock year two funds, which could be up to another 212 million for us. So as of March 26 to June of 2026, the Department of Public Health is sending out individual requests for applications. There is one to date that is posted on their website for dentistry, which is one of the initial pillars, and it has targeted specific organizations, in this case, the departments of health throughout the state. We have assembled a team of about 20 individuals through the School of Medicine Office of Strategy who are scanning that website on a daily basis, looking for those RFAs. And Dr. Klein will probably need your help and the Office of Research and Innovation to disseminate those as quickly as possible. And I'm going to ask for grace from this audience in the same way that the state is standing up this program and staffing it with personnel. We are also doing the same thing as we speak. And we recently learned of this opportunity and all of its merits, probably within the past 3.5 weeks. And so that's what's led to this town hall in a relatively short notice. And I'm impressed that all of you came here in that short time frame. One of the key timelines for this year, and thank you, Dr. Mosley, for identifying this, is the July 1st, 2026 deadlines of all dollars need to be obligated by the Kentucky cabinet, meaning it needs to be allocated. So that means speed is super important in this first year. October 30th, 2026 is the drop dead deadline for finalizing contracts. One of the first requests from the state to us was to identify a top-notch contracting team so that the contracts do not hold up allocations of funds to the university. And I want to thank Provost Cardarelli and President Bradley for offering up their counsel as the lead for contracting for the university. And Dean Bumpus, thank you for offering up Tom Hoy as a backup so that we have two of our best lawyers who are going to be assigned to contracts. So what is the significance of the Rural Health Transformation Program? And why in Kentucky? So many of you in this audience know that we are primarily a rural state. 109 of our counties are designated rural out of 120 using federal designations and definitions. And there's 4 socioeconomic factors that affect health outcomes. And I see people taking pictures, and we're going to distribute these slides for you so that way Mai-Ying, and I know you're on this, but we're going to distribute these slide decks also to the community. So population size and density, median household income, education and employment, and health insurance coverage. And health outcomes, not surprisingly, are poor in Kentucky, especially in rural areas. Our average life expectancy is 64 to 79 years across counties, and definitely in the lower end on our eastern neighbors. I'm not telling you statistics that most of you don't already know. So what are the overarching goals for the Rural Health Transformation Program? It's to focus in on 5 key initiatives: improving access and prevention, strengthen care coordination, support community-based innovation to improve outcomes, and reduce costs and increase quality. For those of you who are familiar with quality improvement language, this type of language aligns really well with quality improvement. And then one of the areas of focus for year 1 is clearly incorporating a digital strategy for community collaboration hubs, community care managements, interoperable data platforms, and consumer-facing technology. And I'm going to talk a little bit more about that in a later slide, right? So the 5 key initiatives, and I'm going to start to transition into the language of the state so that we are all speaking the same language. They like to think of their initiatives as their verticals, right? And so the 5 main verticals, which are well described in the proposal, which is online, is first is the Rural Community Hub for Chronic Care Innovation, right? And specifically in year 1, they are focusing in on diabetes and obesity. So if you're interested in heart failure and other disease processes, please don't think you're being left behind. There are so many chronic diseases that they could focus in on. They're picking sort of their top 2. Maternal and infant health are an important part of this as a second vertical or initiative. And specifically, they're addressing sort of maternity care deserts that exist throughout our state. Behavioral health, rapid recovery, rapid response to recovery is a major issue throughout our state. And so they are focusing on access and care for those patients. And a rural dental access program. So one of our strengths of having one of the two major dental schools in the state allows us to focus in on this pillar, or I should say initiative. I'm using my UofL language now, initiative. And so thank you to Dean Hill, who's not here because she's already assigned. Oh, Dean Hill, I didn't see you there. So welcome. And thank you for assigning Dr. Whitney to come to the state with us, as well as some of your top faculty. And then integrated EMS and trauma response is also the fifth vertical. So what we've identified in a thorough analysis of this rural health transformation program is that there are other initiatives, and that it's better described as probably the horizontals that cut across all of these. And data is key right now. They are trying to aggregate and integrate a massive amount of data from multiple sources in order to analyze it. And so one of the 6 initiatives that we have defined and the state agrees with is data, which is both economic and looking at outcomes as well as just the clinical outcomes also. And then the other area that we've also have looked at in terms of data is sort of a digital strategy, cybersecurity, and AI as an emerging technologies to address some of the solutions for the rural health transformation program. So here is a slide that describes the 5 initiatives in more detail. And it describes those 5 initiatives that I just talked about. The strategic goal is sort of the column in the middle about making rural America healthy again through tech innovation. The maternal and infant health, Dr. Petrushka is focused in on sustainable access. The rapid response to recovery for the behavioral health is based on innovative care. And you're going to notice there's even more tactics to the left, to the right, in terms of telehealth-enabled care, digital health support. And so you can see that theme of telehealth and digital healthcare is going to be one of the main solutions for a lot of these initiatives. Specifically for the dental programs, Dean Hill, they are really focused in on workforce development, since there are a lot of dental deserts, which you are, I'm sure, well aware of. And then for the EMS and trauma response, sustainable access, since again, there are broad swaths of our state geographically that don't have ready access to pre-hospital care as well as trauma care. And that involves coordination with hub hospitals in order to take care of those patients. So here's a very dense infographic that I've attempted to simplify for you about the collective action framework, or their CAF. And then I've highlighted with that big yellow oval the collective action framework about people, process, and technology. But the key area of focus for year 1 is going to be that data. And so we are deploying resources throughout the university to try to address the data. And I also want to thank UofL Health as our primary clinical partner, because they were also at the table with the state, with Dr. Kaz Lawal and Abe Gage attending that first meeting. And then we talked a little bit more about the digital strategy, since that's a predominant theme throughout this program. And so generating the community collaboration hubs, community care managements, and then data interoperability, which when David Ayler's here, so he can help me to translate. I think that comes down to, can the data sources talk to one another, or can we understand them and put it together in a common language? And to put it more specifically, our proprietary EMR systems, and this is not a knock on them, whether it be Epic or Cerner, they don't talk well to one another. And so when you're talking about massive amounts of data coming from heterogeneous areas, it becomes very difficult to aggregate that data together. Am I saying that correctly, David? Because this is outside of my realm, right? Yeah.
So is David here? Otherwise, I can also speak.
Thank you, David. And then for the
Okay.
online audience, David just described how UofL Health is an excellent sandbox because we have both Epic and Cerner as part of our system. And so the ability to talk back and forth is something that the state is very interested in. And then finally, about consumer-facing technologies. And then this is where we get into the telehealth as well as the wearables. That is an emerging technology that Dr. Klein's office is leading the way. So current activities, there has been a flurry of activities over the past 3 or 4 weeks or so. And I'm helping to lead this initiative, or I should say this project, since we're using initiatives for the 5 state initiatives. But clearly, this is well beyond one person to lead. And so we are assembling a large team. And Dr. Bullard-Dunn, thank you for being a part of that leadership team. And we're going to have an org chart to show you. And so we are in the process of identifying UofL leads in each area. The cabinet is also identifying leads. So they are standing up their team as well as their infrastructure in parallel to us. And then we are starting to have conversations as we speak. There are meetings that are being set up this week and next week between our leads and their leads. And then we plan to have sort of a tripartite type of discussion with UK, our sister institution down the road. So that way we're working in a complementary fashion. One of the areas that they've stressed to us is that this is the Commonwealth. So these projects and initiatives are probably bigger than any one single university. And so they're asking us to work together to try to solve these collectively. The cabinet, as I mentioned before, are sending out individual RFAs for each initiative, and they'll vary in target vendors. And so the most recent initiative is the dental hygiene RFA, which is applicable only to local health departments, but needs the collaboration of the universities. And that's why they reached out to us initially. And then they're using a language of objectives and key results. So you're going to see OKRs throughout this proposal. And they're nicely detailed and defined in the project narratives. The timelines are fast for submissions for application. And so one of the aspects of the state is that they're approaching us and other mature organizations that have the personnel, that have the ability to generate proposals in weeks as opposed to months and years. And so building execution teams quickly are being done rapidly around us from there. Now, for those of you who are not familiar with the OKR metrics, you may be more familiar with other similar metrics like Six Sigma or PDSA cycles. It is the language of quality improvement from there. And so setting an objective and then defining that with sort of a key results is a language that we probably can understand if we start to use that. And again, this is an example of how we are starting to use the adopted language of the state. And in fact, they brought in Google experts who initially adopted this language to educate their committee as well as to inform other aspects of the initiative. So here's your first pearl and tip is when you start to think about this, start to use their language of the objectives and key results because it will be more familiar to them. And then Dr. Petrushka, I keep calling on you, but we use the maternal care as an example of how detailed they are with their measurable outcomes. So percentage of pregnant women in rural counties who complete a first prenatal visit within the first trimester. We're talking about bread and butter obstetrics that I'm sure you're very familiar with, but for many of us, we're not familiar with these outcome metrics. And they're setting baselines and targets in relation to the initiative. And so if there is an initiative that aligns well with your strengths, what I would suggest to you is read that area very closely, right? And here is the organizational chart with Dr. Bullard-Dunn and myself as the project leaders, co-project leaders. Now, with the help of Dean Bumpus, we've identified some leaders for other initiatives. So for mental health, Dr. Caudle from psychiatry is leading the behavioral and mental health. Dr. Thomas, the chair of emergency medicine, is leading the EMS of trauma. For the Rural Hub and Chronic Care Initiative, Dr. Becker is leading that initiative. And then we know, Dean Hill, that you're having conversations with your team. So we'd like to identify, we defer to your judgment as to who might be the best lead for the dental health. And then maternal health, Dr. Petrushka, I keep putting you on the spot. We're having discussions with Dr. Francis. And then because it's maternal and infant health, and I'm a pediatrician by training, Dr. Kyle Brothers has already started to rally the pediatrics troops to support that. So timelines, and I think this is one of the key slides for everybody, is that we've tentatively set a May 15th internal deadline for a one-page summary. We haven't yet set up through the Office of Research and Innovation the Google Docs for that, but most groups are already moving on this and sending us one-page Word documents. And I'm asking them to send them to me specifically, as well as to include Lakeisha Ellery, who's from my office as the project manager, as well as my admin, Gabrielle Hunter, so that we can start to aggregate all of these proposals from there. Please do not send us a 10, 20-page proposal, but give us your best in terms of a 1-2-page proposal. The RFAs will drive the timelines. We spoke specifically, and thank you again, Dr. Mosley, because I reached out to Tom Walton, who we know well as a former member of our public health faculty here, who is the director of the Rural Health Transformation Program. And so he has told us that to look carefully at the RFAs, because that's what they're being graded by the federal government. And so there's going to be alignment, and they're likely to approve projects that are in tight alignment with the RFAs. I put the web link for the RFAs out there, although they're easily searchable through Google to find them. And again, I just ask that if you do have a one-pager, that you send it to us so that way we can review it. One of the main things that, and Dr. Boladun and I talked about this, is we're not trying to be the gatekeeper so that we're trying to deny people, but we are trying to make sure that things are tightly aligned with the proposal. And then more importantly, because our university is so massive in so many different ways, and we have so many resources, we want to avoid redundancy. The last thing we want is 3 groups within the university essentially applying for the same project. If that's the case, I think that's where we start to talk to your various deans. Thank you, Dean Ash, for being here. I just noticed that you're here, and others, so that we can start to put together and have a collective effort from the university so that we can take advantage of our respective strengths in terms of our schools and colleges. The final deadline, as you know, the true drop deadline from the federal government is that October 30th for the contracts. And so that's why we work backwards from there. But I think the July 1st one is also an important one to remember. Grab some water. All right, so here are some suggestions based on our conversations with the state over the past couple of months, or past couple of weeks. And I mentioned a few of these already. So read the relevant section or initiative closely, very, very closely. And then here's a direct quote from the state. Follow the roadmap of the proposal that they have laid out for you, especially in year 1, right? Look carefully at the RFAs for the language to align yourself. And then, since the only RFA available, as many groups are starting to use the dental RFA as a template so they can understand how to structure this, as well as there's an Excel spreadsheet for a budget template that's out there. A couple of exclusion criteria do exist, and they're saying specifically, no buildings. Please don't request like a $20 million building to house a new digital rural hub, because that will quickly get X'd out, I think, from there. And then they said no research, but I think Dr. Klein described it well in that they are so focused in on outcomes and key results, and this is so well aligned to quality improvement, that when you frame it in the ideas of, if you have a question, a clinical question, and how you're going to get there in terms of your methodology, I think then later on, there's probably likely several papers that could be published out of that. I think if we mention research up front, it's likely to not be well received, but we all understand that we're asking clinical questions and we're coming up with solutions for them. And then one area that they're very cautious about is no shifting of existing clinical expenses. And so what they're really saying to us is, if you have people working in the rural space already, do not shift their clinical salaries and repackage it in some way and try to take advantage of this. They will quickly identify that and shoot that down, is what they said. Okay. So scoring rubrics, sample year one, and this is still a work in progress, but you can see that it's heavily weighted toward alignment with the initiative goals that's out there. And then based on that, it's initiative health need and target populations, model design and crisis continuum, access, equity, and role reach, workforce strategy and partnerships, evaluation metrics, and data use. And these are pretty standard overall, but you can see how we are trying to make sure that your projects are well aligned from there. Now, Dr. Bullard and I had a conversation this morning. What if you have a great project? So for example, Sunshine, I think there's some people out in Kent School who have some great work that they're doing in depression with the Traeger Institute. And it may not fit exactly into year one, but think about how that could work into one of the initiatives from there. And then there's likely going to be year two funding available also, although there is such a rush to secure year one funding that I don't want to guarantee things, but I'm fairly certain that there will be opportunities in year two and beyond, just based on the timeframes that we're looking at from here. And so I don't want to discourage investigators or faculty who have great ideas that don't perfectly align, but clearly address needs. And then I'm speculating a little bit, but based on our discussions of the fact that our leads and UK leads are talking directly to the state, there's a likelihood that we will be able to influence the future RFAs that are out there. And we've already presented a few mature ideas to the state saying, is this what you're looking for? And they're saying, no, but we love it, right? And so that is leading to further discussions about whether or not some of our existing projects that could be scaled up that we've already piloted could be then used for further types of goals that they're going to come up with. Remember, this is a 5-year process, and so we are in the very beginning state of year one, and so there's still a lot of things that are starting to shake out. All right. Did I keep with the 20 minutes? I'm pretty close, I think, about 23 minutes or so. So this is an opportunity for discussions and questions. And I don't know all of the answers, and I certainly have some help here with Dr. Klein and Dean Bumpus and Dr. Bullard-Dunn, but I'm happy to take questions from the audience. And online, folks, if somebody, Shantori, if you could just check the chat, and if there are questions, then I'm happy to alternate between in-person and online. But how about we start in person, because I'm sure that there's questions coming from this audience. Dr. Petruska, I called on you enough. I apologize for that.
Question. Among the proposals that were submitted already, and the state said that's not exactly what we're looking for. Can you reflect anything helpful to help us formulate next rounds?
I haven't looked at those specifically, just because there's been some interactions between our various institutes, just to get a sense of what the state is looking for in case it doesn't totally fit. But we can talk a little bit more offline about things. But if you see the themes that are going on in terms of, if you have an idea that it addresses the maternal care desert, but doesn't closely align, they're likely to be very interested in that. And they're also likely to be interested in ideas because they see the R1 universities as a source of innovation and for ideas that they did not consider in their initial proposal. Okay.
We have an online question. Should they do a one pager in their area of focus if the targeted area, if the focus is not the targeted areas for year one? Sorry.
I think it's worth considering doing, just because it would be nice to see what the ideas are. And part of the reason we're limiting it to a one pager is so that there's not a lot of sunk time and investment from there. And so the short answer is yes. And then I also ask them not to be discouraged if it's not funded in year one, but know that it may spark a debate and discussion about whether this is appropriate for year two funding. Oh, I'm just going to pause so that the online audience can hear your question too.
I'm Satya Krishnasamy, Division of Endocrinology, Diabetes and Obesity. So my question was, I do a lot of telehealth since 2019 to now with pregnant women and diabetes technology, which is insulin pump, CGM, and all that. So my other question is related to medication coverage. Biggest one is GLP-1. Will this sort of plan will also involve anything which we could help with that, or how will that look?
Oh, You're asking like the trillion-dollar question, right? In terms of and it's a pretty specific targeted one. And I can't say that I have the answer to that, but let me broaden your question a little bit more. Are we going to look at sort of the economics of the situation, right? And the answer is yes. And then the state and our group has had some good conversations to say that in order for this to be truly sustainable, we have to find funding in order to make this sustainable once the federal funding runs out from there. And that's going to likely need to economic transformation as well as clinical transformation. So I'm ducking that question a little bit because it's very specific, but I'm saying to you that they've actually assigned us to go to a CMS seminar about economic changes and policy changes in order to address long-term these solutions. And then what I also think you're asking subtly is that this is not just limited to rural transformation. And I'm going to quote Dean Bumpus because I think that you're correct on this, is that this exercise for rural health transformation is likely to be applicable to our entire state. And so the lessons that we will learn through this 5-year exercise could be applied to non-rural patient populations, although the focus clearly for these funds are on rural patients. Did I answer your question with a pretty complex?
Yeah, I
And,
just
and
wanted
Dr.
to-
Bullardon, please.
Yeah, I wanted to just add to something I heard in your question. Maybe I was mishearing it, but I think one of the things that these funds will not, well, two things that my impression is that these will not cover. One is clinical activity that otherwise we would bill for as clinical activity. And the second would be paying for medication outside of a program. So what I would say is if you want to have GLP-1s paid for your patient population, I think if we could frame it in a way that this is a rural transformation program that involves GLP-1s, and this is how we're going to do it, you might be able to get some funding for that. My impression from the state was if we simply say we're going to use this money to increase access to clinical care by paying clinicians or paying for medications, that probably will not fly because they want something that is innovative and programmatic. So I think it's kind of a gray area, but I don't think we could put in an application and say, you know, we need to pay for GLP-1s for 100,000 people. I don't think that would fly, but if you could build it into a program, we might have get some traction with that. So I think that may have been part of what your question was.
I just, and I wanted to encourage everyone to read the project narrative. Because that'll give you, but that's prior to, I mean, you could do that right now. And that'll give you good information about specifically what is going to be funded prior to the RFAs coming out. And so I don't know if everyone has access to that, but you can look on the Kentucky Cabinet website, and I think it's on the link maybe on one of the slides. But that'll answer probably a lot of questions too.
I put a
Dr.
question
McLean,
in
you
the
had a
chat.
question or a comment?
Yeah,
There's a
we have
I
these,
put a
5
question in the
areas of
chat. Could you
interest or
please?
Pillars. Are you planning on just having one global grant go in for each one or multiple ones from each institution?
I think in an optimal state, we would put it all together. But since this is a pretty tight timeline, I don't want to hold people back, so to speak. And so I think that's a discussion that Dr. Klein and I will have. We want to make sure that we're not duplicating our proposals. At the same time, I think we have to balance that between speed, because we want the state to have adequate time to review and approve, or if they have any feedback for us, to be able to alter the proposal. But I'm open to discussion, and Dr. Klein, if you feel differently, I'm open to that too.
I got a question
I
here.
have a similar question, but probably.
Can you answer that first? Yeah.
Yeah, just a real quick answer. I mean, I generally favor large programmatic approaches, but you know, the cliche is we're building the airplane while we're flying it. And so I don't think we're going to be able to do that unless some incredible push occurs.
Right.
And kind of a corollary to that. So if we're trying to put in a big program, get it funded, I assume the university's coming, the money's coming to Louisville. U of L?
The short answer is yes.
Okay,
Yeah.
so then we're gonna just dramatically have to change the way we hire people here. So sometimes now it'll take a year to hire somebody.
Dr. McLean, I'm not disagreeing with you. At the same time, we don't have to start spending the money until 2027. So the key is getting the proposals approved and then funded, and then we can start to spend the money from there. So if that's the case, then that gives us enough runway potentially to go through the hiring process. And then also keep in mind that some of our partners throughout the state may be hiring in local areas, which is the preference of the state. And we've learned from our experience, and Chris is nodding his head through the LCTRC, that sometimes it's a little bit easier to hire through subcontracts through the various partners that are out there. Although I'm not going to really touch that whole HR question that you just posed from there. I think you had a question right there.
Yeah, I try to follow like a similar question, but still very confused. And you said have 5 areas, and one is like maternal health.
Correct.
And also have some behavior and obese and like diabetes. But I think maternal health is have 2 kind. It's only for mom. That is one focus on narrow down the mom health. But the maternal health actually that affect children's. That is children's health like include behavior, obese kids, and so that is a kind of the like sensitivity increased for disease. So probably the maternal health probably can include the both the direction. So that is like I didn't figure out you have that idea or not.
Let me make sure I'm phrasing your question. Is that maternal health extends to the baby and beyond is what you're suggesting. And that is true. And so some of the outcome measures in maternal health, like avoidance of NICU admissions, NICU stays, are common quality improvement metrics that will be included
So that is included.
Yeah, so
okay.
so a better description, and I may have neglected to say this because I'm a pediatrician, is it's really a maternal infant health initiative,
So
since they are tied together for 40 weeks.
Yeah, that should be child impact of the maternal health situation. So something like that.
Yes. Did I answer your question then? Yes. Okay. Dean Bumpus had a comment.
Yeah, thanks. And I think this is all very informative. I think one of the things that this audience really needs to appreciate, though, is going back to the original legislative intent from the federal government and the mandate to the states. So success will not look like this, just a university initiative without identified, credible partners in the community throughout the Commonwealth. That will not be successful. What will be successful is leveraging current partners that we are engaged with, developing new partners, which is a little heavier of a lift because we don't have history, trust, et cetera, the things that are necessary for success in that dynamic, and consortiums of our partners in rural counties, those some 107 counties you identified. So I think the other aspect of this, and you mentioned it, but in the application one-pager RFA process, is to really very explicitly define those community partnerships and those community consortiums that we'll be working with.
And I think we had a question online in line with that said, will there be opportunities to collaborate with local businesses to help advance the project?
Yes, yes, and more yes, right? And in fact, that is actually written into the proposal in that they would love to have an economic positive impact to these communities by hiring within the communities themselves. And so I think that will definitely improve the likelihood of being funded if you develop local community partners. But this goes back to what Dean Bumpus was saying, is that it's time to look at our partnerships that are out there, see what relationships exist, make sure that we have not neglected them in the past, and start to nurture them, and know that it won't happen overnight, right? And so this is an opportunity to develop relationships. And this group is sophisticated enough to know that many things are relational in nature. And so earning the trust of the communities and these organizations is going to take a little bit of time.
Yeah, I got a question.
Oh,
Is there any,
that's like a setup. So we have some additional slides to answer that question because so we do have some business intel that says that there's likely to be 3 area development districts, ADDs. That means something different in pediatrics, but in this case, it's area development districts, right? And you can see they're geographically spread out because I think that there's something political about this. So the farmost western area is the Jackson Purchase Area Development District, which includes Paducah. The middle one that's in the yellow circle is the Cumberland Valley region. And then the far eastern one that's in the red circle is the Big Sandy region. And so our understanding is that year 1 will start to focus in on these areas as potentially areas of interest. And so that may also enhance your likelihood to be funded. And so if you have existing relationships with those areas, then this is the time to pick up the phone. I know Dr. Cottle is probably online because I don't see him here, but that guy has placed a couple of dozen phone calls in the past couple of weeks to specific areas. Dean
Yeah,
Bumpus?
I think a correlated to that, if we could map our current assets and relationships within those zones, it would be very helpful because then we really kind of are collecting who we are reaching out to. One compliment again to Bob Caudill is he's also identified people that we don't currently have relationships with, but we know where we can build some new consortiums here. But to have a U of L specific map that aligns resources to these developmental districts would be very important.
That's perfectly aligned with Dean Turan, who may be on the call, and that she has GIS mapping faculty. So again, this describes we have a massive institution. We have tremendous talent throughout that perhaps we don't always organize or tap into. And so, Dean Bumpus, if we can start to categorize and collate that information, and what I would say is send it to my team, send it to Lakeisha Ellery, send it to Gabrielle and myself, and then we will not do the heavy lifting because thankfully I have a team of 20 to help with me for the Office of Research and Innovation. And in fact, we're meeting after this, and this would be an example of some of the data collation that the team could take on, Dean Bumpus, to start to organize our assets and create sort of a U of L specific map. And then how it overlays on top of these area development districts is a starting point for us. And then we can start to put up flags for the Kent School of Social Work, for the School of Nursing, for the School of Public Health, so we know who is assisting with those relationships and those assets. And for those of you who aren't familiar with that, this is incredibly powerful stuff. And Dean Turan, if you're on the call, I'm going to be reaching out to your mapping faculty shortly after this meeting. They're here, they're waving at me. See, they understand what we're describing. I'm sorry, and you had a question?
So thank you for organizing the event. So I look at it, we have this 5 verticals, and but online, this is the 5 verticals that's a strong emphasis on digital,
correct,
and AI cybersecurity. And also on the 5 initiatives, seems that you also always have this telehealth. So my question is to you and to all the people getting involved, how do you vision actually, we use AI to basically, make this more successful? Seems that they emphasize also the newer technology for this transformative initiative. Thank you.
So I think you're asking the multi-trillion-dollar question of how AI can help healthcare. And, there are smarter people than I'm going to defer on this since I'm not an AI expert, but we have a lot of AI expertise within the university. I see Adam was in the room, who's already defined a lot of machine-based learning for AI. And so I think that there is a wealth of opportunities that we've already started to deploy and investigate for all patient populations, but in this case, we can target it towards the rural health populations from there. So that's a little bit of me passing on to others about what we might do, but we have some infrastructure around AI and healthcare that we could start to deploy for this project. Right.
My question is related to the same topic. Is there any cost
I'm
allocated to
the
AI
AI
driven
research.
project?
The current frontier models already basically on par with the doctors. Okay, basically from research from the labs. However, if you look at headlines, And we get based on the survey, recent survey, almost 2/3 of the US population are against AI because they consider it a nuclear bomb, job killer. So if we want to incorporate this newer technology into the 5 initiatives, how do we want to brand it, package it? Because we don't want people don't want to get killer, get involved in this, make a decision, right?
I don't know if I have enough time to answer that question, but let me rephrase the question. You're talking about the cultural resistance to technology adoption in general, whether it be AI, smartphones, and so on. And so I think Jeff Guan, the former interim dean of this College of Business, and is an expert on technological adoption, and has described that AI is almost a technology adoption change management type of a situation than it is more of a technological situation. And I think your question is well informed because there's clearly a human element to this, and that human element may be resistant to AI. And you'll notice that AI is not necessarily at the forefront of our technological adoption for this, but at the same time, to ignore it, I think, would be not in our best interests. Okay. Did I partially answer that question? Because I don't think I'm qualified to fully answer it, but I do see what you're getting at from that question.
We do have another AI-related question. Are there any funds allocated to AI-driven projects related to clinical outcome and designing a program, and for example, early diagnosis of cancer?
That's a very targeted question. And then based on my 4 reviews of the rural health transformation proposal, I don't necessarily see a space for that, but I think we'd have to review it more specifically, right, from there. And then if you were to reframe that question into how can you more easily identify in a rural health-based population early cancer diagnosis, I think you might get more traction with that. And then if you reframe it again through AI augmented approaches to that may be more beneficial. But that's a good example of how, since the emphasis for the 2 chronic diseases are diabetes and obesity, that may not play in year 1, although I think a closer examination may be worth doing. Right.
One thing, if I were going in that direction, I would go in the direction of obesity-related cancers and the prevention thereof. If you're having a disruptive approach at addressing obesity in the Commonwealth of Kentucky, and one of the endpoints might be cancer development of colorectal cancer, for example, that may be an area where you could bring oncology into it. There's not an oncology lane specifically this year, but I think, the limits of this are your imagination, creativity, partnerships, intellect, and industry.
Thank goodness we have a dean that's a ENT oncology expert. But I love that answer, Dean Bumpus, and that we should free our minds to think about how we can align with this in new and creative ways, right? And so if we created a narrow lane for that question, the answer would probably be no, but now we've opened ourselves up to other possibilities too.
One more online question. Can they submit multiple one-pagers?
The short answer is yes, but what I've been telling groups are, because of the timelines in year 1, try to limit it to your 2 or 3 best ideas, right? If you come up with 10 ideas, I've had some groups come with me and say, can I submit 10? And I say, we don't have time for you really to develop 10 as big as your team is. Give us your 2 or 3 best ideas for this year, but keep those other ideas available for potentially year 2, year 3, and beyond. Oop.
With a couple of the initiatives, you identified particular topics as really the focal points, so like in behavioral health, you identified telehealth. Does that imply that focuses on paramedicine or the empath units isn't going to be a focus for UofL?
Are you saying that let me rephrase that question. By focusing on the rural health transformation program, are we in any way going to negatively impact existing programs?
No, you identify Dr. Caudill
Right.
and indicate that telehealth is a focus. The other 2 aspects of the behavioral health side was paramedicine and empath. So within, applications, is the emphasis really just going to be on the telehealth side, or is it open to consider the other two factors?
Oh,
as well?
sorry, I misunderstood your question. Clearly, if it's within the mental health initiative or behavioral health initiative, it's all fair game. There's not a prioritization. The fact that it's within there means it's a high priority type of item. And Dr. Mosley, you can correct me if I'm wrong in that if it's within the proposal, especially if it's targeted as a year one goal, by all means, please generate some ideas behind that. Wait, can you give her a mic so that the people can?
In the project narrative, there's examples of success to give you guys ideas. So I know it's 62 pages of text to read, but for each of those initiatives, under each initiative, there's success examples that you could go to that link and read to get creative ideas. Because as Dean Bumpus said, this is meant to be innovative, transformational. And so please rely on that document to give you ideas. Think about how you can cut across the different initiatives and be collaborative with each other.
Thank you, Dr. Mosley. Shantori, there's another question from the back.
To sort of piggyback off of Dean Bumpus's suggestion. So for example, a robotic solution for telesurgery to target cancers that are a conclusion of obesity, would that classify as a potential idea that is transformative again and is aligned with objectives?
I think that I'd have to see the full one pager and then evaluate it against the proposal itself to see how tightly that aligns. That may be a little bit of a narrow focus, and it could be a stretch. I'll be honest with you, but I don't want to discourage you because I don't think I fully understand what you're proposing, and I would love to hear more about it from there. And then keep in mind, if you have a great idea, now's the time to generate and think about it. Because again, if you have let's say that we propose this idea to the chronic care initiative, and it turns out that there are other institutions that are going to rally behind this, and then there are strength in numbers, that proposal could easily rise up in terms of its fundability from there. Okay. Okay.
Yeah.
Yeah.
That are in it's going to and so that help you write this.
Shantori, do we have any more questions online?
Yes, we have two more. How are decisions going to be made on what moves forward to the state from the one-page submission?
I think that's still a work in progress in terms of determining who's going to be vetting things. And then the truth is that we had this discussion earlier this morning, and that we don't want to be too much of a gatekeeper. At the same time, we want to avoid redundancy, and then we want to avoid proposals that are clearly not aligned with the Rural Health Transformation Program from there. So again, I think that will become more apparent in the coming weeks as we determine that. We do have rubrics that we have developed based on the 5 initiatives, which I shared one for you that's heavily weighted towards alignment. So I think that's going to be our starting point. I've also talked to people that we will have human eyes also look at all of these proposals. While I am a proponent of AI, I'm not a sole proponent of AI as the final determinant of what value each proposal has from there. Okay.
Right. And the second question, how are these funding avenues changing the clinical or research curriculum in the medical school?
I think that's too soon to say, to be honest with you, since we're sort of in square one of that. But it would be great to have long-term impacts in terms of our educational curricula down the road. And I don't know who authored that question, but clearly they're thinking about something. So feel free to email me your thoughts, because I want to know more about what created that thought.
My question was, there's a medical school in Pikeville in the Big Sandy region that's circled up there. Has anybody talked about collaborating with them?
The short answer is we should be considering collaborating with Pikeville since they're in the Big Sandy region. And so have we reached out to them specifically? Not as of yet, since I think we are starting to build our own team, but certainly along the line of discussion, we will have more discussions. And then keep in mind that we are a partner at the table. We don't control the table, so to speak. But if you do have collaborations ongoing with Pikeville, now's the time to let us know so that way we can see if that blends and aligns well with our proposals. Did I answer your question on that?
So, Dr. Kim, if I can just comment on both of those questions. The first is in terms of education and curriculum. Although these projects don't specifically address education and curriculum, at the same time, there is a huge emphasis across all of the initiatives for healthcare workforce development at all levels. And within that, there is room for increasing our rural educational opportunities for learners across not only our health sciences center and university, but in collaboration with our partners. And to that point, we do have collaborations with Pikeville on multiple levels through some of our UofL adjacent organizations like the area health education centers. We work directly and do interprofessional education with Pikeville. So those are some of the things that I think it will ultimately affect education, and we will strengthen those partnerships with places like Pikeville, even if it isn't written as an education pillar. I think if you were to propose a collaborative effort with Pikeville to increase healthcare workforce development education in regions through a collaborative activity, that would be very popular and very well received.
Well, this has been a really robust conversation. I thank everybody for coming in person. I really prefer the in-person, Dr. Klein, because there's just a richness to this interaction. I want to be respectful of everybody that we're at the top of the hour. I'm happy to stay and talk some more. I do have to leave at 3:30 to activate our team to start to assign projects to our projects, but I'm happy to talk some more. And thank you for all the online attendees and the excellent questions that are out there.